Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, thank you for watching my presentation. It's great to see you all. Okay, let me introduce myself. My name is FITRIA SARI. I'm student of postgraduate program of Public Health University of Halo, Indonesia. Today, I will present my article entitled Diabetes Mellitus Surveillance Data in South Konawe Regency, Southeast Sulawesi, Indonesia. First, I will explain about diabetes mellitus in general. Diabetes mellitus is listed as the deadly disease in the world with a prevalence increase significantly every year. Diabetes mellitus is characterized by symptoms of frequent eating, polyphagia, frequent drinking, polydipsia, and frequent urination, polyuria due to failure of sugar to enter the body into the cells to be processed as energy due to the inability of the pancreas to produce sufficient insulin or not at all. The background of the article, the World Health Organization (WHO) estimates more than 346 million people worldwide have diabetes. The number is likely to increase more than double by 2030 without intervention. Based on the data from the Southeast Sulawesi Provincial Health Office of the years 2015 to 2017, diabetes mellitus was included in the top 10 diseases. Diabetes mellitus was ranked 5th with a total of 2.436 cases. According to the International Diabetes Federation 2019, it is predicted that there will be an increase in diabetes mellitus cases in Indonesia from 10.7 million in 2019 to 13.7 million in 2030. The methodology of the article. Andoolo is the capital city of South Konawe Regency. It is one of the regency in the Southeast Sulawesi province whose territory has boundaries including to the north bordered by Konawe Regency and Kendari City, to the east bordered by the Banda Sea and the Maluku Sea, to the south bordered by Pombana and Muna Regency, and in the west bordered by Kolaka and East Kolaka Regency. This study used various data from the Indonesian government agency. Diabetes mellitus case data was obtained from the South Konawe Health Office from 2018 to 2020. The data was obtained from the annual health fact sheet published by the South Konawe Regency Health Office. The result of the article. Figure 1. Number of diabetes mellitus cases by years in South Konawe Regency. In Figure 1, we can see that based on the spread of diabetes mellitus from years to years, the results show the diabetes mellitus patient spread fluctuated and the peak occurred in May. The seems to be stable in July to August but increased in September. Figure 2. Number of diabetes mellitus cases by district in South Konawe Regency. In Figure 2, it can be seen that based on the sub-district in South Konawe Regency, in the years 2018 to 2020, the incidence of TM was the highest in Andoolo Utama sub-district, then in Lainea and Lima Marwa sub-district. Figure 3. Number of diabetes mellitus cases by age in South Konawe Regency. In Figure 3, explain that based on the age, the spread of TM suffer are fluctuating. In the years 2018 to 2020, the number of cases has increased from the age 1 to 4 years old, 5 to 15 years old, 15 to 44 years old, and the most in the age range more than 45 years old. Discussion of the article. Diabetes mellitus is ranked as the fourth most common disease in the South Konawe Regency. In the years 2020 was 8.2%. The number of diabetes mellitus cases from 2018 to 2020 are continued to increase. It is related to the instant-based eating habits that is very popular, which can lead increase of blood sugar level. Likewise, cigarette smoking is one of the factors that cause uncontrolled blood sugar levels. Therefore, it is necessary to instill in the community to implement a healthy lifestyle to avoid various diseases, especially diabetes mellitus. In addition, it can be done by adjusting the diet, exercising according to the doctor's advice, taking medication regularly and diligently shading the eye, visit to the doctor, stress management, limiting exercise physical activity, and paying attention to sleep habit. Diabetes mellitus cases by sub-district in South Konawe Regency from 2018 to 2020 is continued to increase. The highest cases are in the Andoolo Utama sub-district. Andoolo Utama is the capital of South Konawe Regency, which is the center of office and social activities. Andoolo becomes main source of this disease, which is not realized by the public, especially those who have a busy level of activity. They are possibly risk of the metabolic disorder and will eventually suffer from diabetes. Diabetes mellitus cases by age in South Konawe Regency have increased from 2018 to 2020. The most cases of suffer are more than 45 years old. Human physiological change is drastic on the age of over 40 years. Diabetes mellitus often appears after a person enters the vulnerable age range, namely after 45 years old. Age is one of the risk factors for DM. As one of the degenerative diseases, diabetes mellitus generally affect people aged more than 40 years old and the elderly. Clinically, hyperglycemia is often found in the elderly, namely at the age of more than 60 years. Conclusion of the article: Diabetes mellitus is a deadly chronic condition that happens when the body cannot produce enough insulin or cannot use the insulin. Diabetes mellitus is diagnosed by observing elevated level of glucose in the blood. Risk factors for diabetes mellitus are genetic factor, age, lack of physical activity, and an unbalanced healthy food and diet. Diabetes mellitus is a disease which prevalence continues to increase year by year. It can be concluded that diabetes mellitus has become a global health program or disease in the world. So many presentation from me. I say thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. See you.